Hello everyone. So in this lesson we'll be discussing the Trichobezoars, commonly known as hairballs, a condition that many cat owners might be familiarized with. So hairballs is a condition that frequently affects cats, but can also occur in dogs. It usually results from self-grooming, but in homes where there's more than one cat and they lick each other, it can also lead to throwing up hairballs. Cats spend lots and lots of time grooming themselves, and with that action, they ingest small amounts of hair. The hair is made of keratin and it cannot be digested, so it normally passes through the intestines and leaves the body in the feces. However, in some situations, the hair may become tangled on itself within the stomach or intestines and originates a mass of hair too large to pass in the feces, resulting in a hairball. Once these hairball forms, many cats simply vomit the hairball, and a lot of cat owners often see this, or it becomes lodged in the gastrointestinal tract, leading to an obstruction. Hairballs are more common in cats with an underlying gastrointestinal disease because they may have altered gastrointestinal motility that restricts the air from moving forward through the gastrointestinal tract. In other cases, cats with allergies or other skin disease are also more likely to have hairballs since they have itchy skin, so they spend a lot of time licking it. In many cases, the only visible clinical sign is your cat vomiting a hairball. In cases where there is obstruction, you may or may not see the cat vomiting. The cat may have abdominal pain, is lethargic, and may stop eating and drinking. Since in many cases there's a gastrointestinal disease or skin problem underneath, a cat vomiting hairballs should have a good physical examination, dermatological examination, and blood examination to assess general health. In cases of obstruction, search for signs of abdominal pain by palpating the abdomen, and it will probably be needed an abdominal x-ray to see if there's signs of obstruction. In some cases, it may be helpful also contrast x-ray, so to study the flow of material through the intestines and identify where is the obstruction, if any, or maybe also need an ultrasound. In cases of obstruction, the airball has to be removed. The removal can be performed with an endoscope down the cat's esophagus and into the stomach or via surgery. In some cases, there are airballs in different sides of the gastrointestinal tract, and so different points of obstruction may be present. Most cats respond well to surgery, but it has to be performed quickly after seeing the first clinical signs to prevent further damage to the intestines. So, prevention of airballs lays on first treating any underlying gastrointestinal or skin disease. Anything that affects the gastrointestinal function may make your cat more prone to airballs because of altered motility, as we discussed. Also, treat skin allergies to minimize air ingestion. We can also give hairball specific diets. Discuss with your vet if a hairball specific diet may be a good option for your cat. These diets contain high levels of fiber that helps to move hair through the gastrointestinal tract and reduce the risk of it accumulating into hairballs, and are also designed to improve the health of your cat's hair and minimize the amount of shedding. Regular grooming is also important. Groom your cat regularly on a daily basis. The more fur you remove from your cat, the less fur that will end up as hairballs in their stomach. Also, to long-haired cats, consider taking them for a haircut every 6 months or so. Hair supplements or medications may be needed. There are a number of different hairball products on the market today, most of which are mild laxatives that help hairballs pass through the digestive tract, but always discuss with your vet before trying on this. And discourage excessive grooming. If you suspect that your cat's hairballs are a result of compulsive grooming, try to train your cat to do another enjoyable activity instead of licking their coat. This might includes teaching them to play with a new toy or finding a fun toy you can play with together, I would advise a behavior consultation with a specialized vet to see how we can help with this behavior. So if you have any questions, please leave a comment below, and if you like this video, like and subscribe. Thank you.